This episode of Distraction is sponsored by Landmark College, offering comprehensive support for students with learning disabilities, ADHD, and ASD. Learn more at lcdistraction.org. Landmark College, we teach differently. It turns out that if you have ADHD, your risk of developing addiction depends upon what study you read, but it's from 5 to 10 times more common. 5 to 10 times more common that you will develop an addiction, either to a chemical substance or to an activity or both. Hello, this is Dr. Ned Hallowell, and welcome to Distraction. Today, I'm very happy to welcome back one of our favorite guests. Kristin Seymour is beloved in her hometown of St. Louis as well as wherever she goes because she spreads not only goodwill but good knowledge. She grew up in hardship. She had ADHD. She didn't know it. She suffered with it, and then she took it upon herself to become an incredibly accomplished woman, became a clinical nurse specialist specializing in cardiology, one of the toughest specialties there is, became accredited at Barnes Jewish Hospital in St. Louis, one of the toughest academic hospitals there is, and then set about becoming incredibly accomplished in the world of ADHD, coaching, writing a book about her own experience, overcoming her struggles there. And so she basically has two realms of expertise, one in cardiology, the other in ADHD. And she is one of these ADHD whisperers. She understands it before she even knows it. But today I want to tap into an area where she is an expert, and I've just finished writing a chapter about it myself for my new book, and that is the overlap between ADHD and addiction. And I'm going to frame the topic because it's a huge topic, and then I'm going to let Kristin take it from there because she has a lot of hands-on experience in schools. It turns out that if you have ADHD, your risk of developing addiction depends upon what study you read, but it's from 5 to 10 times more common. 5 to 10 times more common that you will develop an addiction, either to a chemical substance or to an activity or both. And a third statistic that I want to have you know about. Guess what percentage of people with addiction get help? What percentage get help? 10%. That means 90% get no help. This is a crying shame. 90% get no help. So if you get treatment, with chemically assisted treatment, the success rate is way higher. It's just that only 10% are seeking it out. Okay, so with that as a framework, let me turn it over to Kristin, who has direct experience with this in the schools of St. Louis.
Yes, thank you, Ned. That's all fascinating and unbelievable, remarkable information and statistics about addiction. It's quite, I call it, it's like a demon. I mean, it can destroy and destruct so many people's lives. Their families are torn apart. The student falls apart because of it. And what's really frightening and scary is the amount of addiction that's happening with nicotine with these students as young as 5th and 6th grade, all the way through seniors in high school and even in college, the vaping and the juuling. They become so addicted to their juuling device or their vaping device. There's many. There's Soren Air, there's Blue, there's Bow Vape, there's caps, there's mods, there's pods, there's e-liquid, there's wax, dab, edibles, marijuana. You know, it just escalates because they become so addicted to the nicotine that they end up plateauing and it doesn't satisfy them anymore. So with that tolerance, they then escalate to possibly pot or marijuana. Then they escalate to maybe some wax, dab, which is it's a much more potent marijuana. Wax and dab is made, they extract part of the cannabis from the marijuana plant and they make it with butane oils. And it's a very waxy substance that they end up heating up and smoking. It's 80% more potent than a regular marijuana blunt or joint. These kids are accessing all of these different illicit substances from all over the internet, from Snapchat, from wherever. It's so accessible to them. And they will trade things like, Uber Eats. Like, let's say a student will buy lunch for a bunch of kids. So the parents don't even have any idea how these kids are getting these drugs and these substances because these kids are so smart and clever. Long story short, they come to me so addicted, they're jonesing. They can barely go an hour without hitting their Juul or their vaping device. So it's quite scary. And some of them are becoming alcoholics. I have a couple patients who I am concerned about that drink way too much, and there's alcoholism in their family, and they're ADHD, so they're more prone, and he's in the demographic of 13 to 23. So, watching it before your eyes and then collaborating with parents to say, we need to do something like now. Some of these kids need to go to recovery before they even go to college because they're self-medicating and or have dabbled in it and become so addicted, they become addicted to it, especially this nicotine. That's the scariest.
And is it the Juuling that gets them that makes the nicotine so available?
Yeah, the Juul, okay, that's just the brand, as you know. I know you know this, but the Juul is the most accessible because it looks like a USB port or cable, if you will, that can plug into their computer. And it's so inconspicuous that's probably the most common one that I'm aware of, but they all have different types of vaping devices. It's that little pod that they put in that Juul and heat up to 400 degrees Fahrenheit and then inhale the vapors of that pod that gets them that's got the nicotine as well as over 200 different toxins and carcinogens in that teeny little pod. So the students, I had one patient who was an adult who was a smoker, a history of smoking, and then took to vaping, and he said, you won't believe how much stronger that vape and that pod is than cigarettes with the buzz. These kids are getting nicotine buzzes from this. And in my patients' cases, since all of them are ADHD or, learning disabled, but mainly ADHD, in my patient situations, a lot of them find that nicotine, the stimulant effect of it, it helps them to focus and produce. And that's they're not taking their medication for ADHD for whatever reason, and, they're self-medicating with this nicotine. But the side effects are so bad. They get mouth sores and it can explode in their mouth. And the bottom line is it escalates into alcohol use and chewing tobacco and then wax, marijuana, dab, edibles, and then up to Xanax. And then they go into heroin. So we're entering junior high on Juul and vaping, and we're graduating on heroin. It's basically in opioids.
What is the school or the city or parent organizations or health organizations doing to contain it, control it, prevent it?
Well, one local public school here in St. Louis, it's an excellent school district, brought me into their middle school assembly. And I did talks for 6th, 7th, and 8th graders. And I wore my lab coat, to command their attention as a clinician. And then I put a slideshow up of the scariest slides you've ever seen of kids losing their teeth because it exploded. The Juul vaping device exploded in their mouth when they were inhaling. Pictures of what they look like herpes throat mouth sores that occur from Juul and from these vaping liquids and pods and smoke vapors, if you will. These pictures will scare anyone, but they are monitored by a psychiatrist to make sure they're not too scary and give them nightmares, but it is, you almost want to scare them straight. So I did this talk, and there was no parents in the room, just teachers and counselors, and they thought it was really good. And after it was over, they probably had, I want to guess, between 18 and 21 vaping devices in the trash can by the parking lot. It scared them to death. And so the Department of Health and Human Services medical director here in St. Louis, I met with him, and he was extremely supportive of this talk because it scares them straight because they think they know it all. And when you come to them and say, I'm not going to tell you not to Juul, I'm going to show you evidence and facts and pictures of why you won't want to Juul. And then they listen because you're not going to preach and nag them. And by oath, I only can tell you medical truths and facts, not my opinion. So long story short, that is something that St. Louis is doing. In a lot of other schools, the NCADA is doing similar talks. It's different than mine because they're not clinicians giving them, but I do believe that does help the students when they know that you're an expert in the field, heart and lungs, cardiology. So yes, so that is what St. Louis, I do believe, is doing to help contain it, if you will. They're also putting nicotine sensors in bathrooms of new buildings and schools, so that because they're mainly vaping in those bathrooms. They're also putting hallway monitors and bathroom monitors in these schools, and inform parents through assemblies.
All right, we'll get back to the conversation in a few moments, but joining me now is Jan Copeland from Landmark College, that wonderful college in Putney, Vermont, the college of choice for students who learn differently. Jan is the Director of Career Connections at Landmark and is here to discuss how they prepare their students for careers and internships. It's really nice to have you on Distraction, Jan.
Thank you for having me. It's great to be part of this conversation.
Tell us about what you do and how Landmark does, in fact, prepare its students for careers in the great outside world.
I think one of the distinguishing pieces of the work that we do is that we're a very high-touch office. So a lot of times career offices, you come in quickly, you have an appointment, once a semester. Given the Landmark model and our students and what they're looking at and they're navigating, we really believe in them being given the option to meet as many times as they need to with our office. It's very individualized. We work from a strengths-based approach. There's a lot in society right now that it makes some assumptions and has some biases about individuals who learn differently, who are neurodiverse. And particularly in the workforce, they can come up against that in job searches and in placement. So we really help them to understand the strengths that they bring, the assets that they bring to the workforce, versus working from a deficit and having to apologize for their differences in how they see things or how they work.
Mm-hmm. And you help them find jobs.
We do. We do an array of things. We help them find jobs either on campus or an internship. In this gig economy today, there are probably going to be an array of different jobs. So we give them tools to navigate that process as well.
Can you give some examples of jobs and careers you've placed your students in?
Yes. I mean, we have an array of students, an array of student interests. We also work very closely with several corporations that embrace neurodiversity, like JP Morgan Chase and SAP and DXC Technologies. So we've had some students go and work with candidates there, job seekers, in mock interviews. And we have some students that are in the process of being selected for positions at Ernst & Young, EY.
That's terrific. That's terrific. Well, Landmark is lucky to have you and your team. And as you say, these students bring a tremendous number of strengths to what they do. And Landmark helps them, as I like to say, unwrap their gifts. And then you help place them in the jobs that they're best suited for. Thanks a lot for coming on Distraction, and thank you for the work you do at Landmark.
Oh, you're quite welcome. Thanks for talking to me. Have a great day.
If you'd like to learn more about Landmark College in Putney, Vermont, visit lcdistraction.org. Okay, let's get back to today's topic. Well, it's totally frightening because by the time the habit becomes so bad that they want to get help, a lot of damage has been done.
Correct. So like that popcorn lung, it's an irreversible lung disease that comes secondary to these vaping liquids because of the flavorings, the glycerin, the propylene glycol that's in some of the oils, and not all of them, but some of them. And it's almost, well, I believe in my clinical opinion, it's worse than lung cancer because with lung cancer you can remove part of a lobe, of an affected part of the two lobes of the lung. But this is an irreversible, permanent lung condition that some of these kids are at risk of getting.
What's it called again?
Popcorn lung is the nickname. So back in the day out in the East Coast somewhere, I just can't remember specifically, I think it was Philadelphia, where they were making butter-flavored popcorn back in, I think it was like the 80s. A lot of the workers in the popcorn plant, the flavor were developing this lung disease. And eventually they figured out it was the flavoring of the butter in the popcorn. For these factory workers, they were inhaling this all day, and they were getting this condition, this lung, this I call it like a crystallizing, like hardening almost of your lungs. And it really doesn't, but it makes them unable to inhale and exhale and be so resilient. So these people, they nicknamed it popcorn lung. They changed the flavoring. The FDA approved propylene glycol and glycerin at a very small level for food flavoring to go into the stomach that has been cleaned of that additive, that was in the popcorn at such a high level. So, but they never approved it. The FDA never approved these chemicals to be going into your thin, delicate lung cavity. So that's how these companies get away with using it. Do you follow me? So they just put it, these are not to be inhaled in your lungs. These agents, these chemicals. And in fact, they break down surfactant, which is the chemical which is in your lungs that helps you when babies are premature. They put you in an incubator to make your lungs mature. So these additives and these chemicals and these jewel pods and these different vaping devices are going to break down and ruin your lung surfactant. So these are all facts.
Yeah, wow. Well, it's, all the more reason to educate.
Mm-hmm. I called Juul Company and spoke with their legal team. I went as deep as I could on the dive to getting the facts from the resources and the government. And sure, things change. This is all my information as of when I did my big international talk in November. But they're really, they make them flavored like cotton candy, creme brulee, mango, and mint, so that the kids, the vapor smells good to the kids.
What did they claim they were still an anti-smoking product?
Yes, they did. I tried a Juul once just to see what all the fascination and hype was, so I ordered it online. I went on to Amazon. It was as easy as 1, 2, 3. I just literally put in my birth date. Any kid can put in their birth date and lie on Amazon. All parents, not all, I apologize, but many parents, I think, allow their children to buy things on Amazon for school or whatever, and with their permission or whatever, and these students are ordering these Juuls or Sorens or Blue Bow, all these different brands off the internet, off of Amazon or whatever company. I'm not trying to throw Amazon under the bus, but they throw out the birth date and they'll ship it right to your house on to the door, and the parents have no idea. It looks like a USB port or like a charging device for your computer. The student can get it with a fake birth date. Parents have a credit card on the computer. It's ridiculous. It is so accessible. It's unbelievable. But anyway, I did try it, and it honestly, I did the mango pod, I think is what I did, and it was awful. It felt like I was inhaling glass particles, like chips, going down my lungs and throat. And I'm like, what is so, fascinating to me is why are they enjoying this? This is worse than the worst cigarette I've ever had. And the buzz is horrible.
We've touched the surface, or we've hit one part of a huge topic. I just want to send out one more word of caution, and we'll do another podcast on addiction and ADHD. The other one I want to emphasize is make sure you stress to your kids when they're at a party, never, ever, ever accept a pill of any kind, even if someone says to you, oh, this is perfectly safe, this is just fill in the blank, because one fentanyl will kill you, and you don't know what's in one of those pills.
Exactly. You're exactly right. And you have no idea what's in the pill. You have no idea what drug dealer or where they got that pill. And 1 grain of fentanyl on your tongue can kill you. 1 grain, like a salt grain. That little can kill people. It's unbelievable. It's 100 times more potent than heroin.
And it happens. It's not like this doesn't happen. It happens every day.
Yes.
You know better than I do because you see it at the hospital, probably.
Right. Yeah. 146 Americans die daily of all various ages of an opioid overdose. And in St. Louis County, not the city, in 2017, we had 390 opioid-related fentanyl cocktail deaths in this not little, but St. Louis County. We're not talking a huge, massive coastal city. And that's not even including the city deaths. I mean, we're talking 18-year-old, 21-year-old, Caucasian, male, Kirkwood. You never know.
Well, we have to stop. So let's end with a note of hope and encouragement. We've raised awareness about the problem, which is a big problem. But what you can do about it is education and prevention, right?
Absolutely.
These kids, remember, with their being young to begin with and having ADD on second, they think they're immortal. They think nothing can hurt them. They think everything you have to say is sort of in one ear and out the other. So you got to keep pouring it in one ear. Don't worry about being a nag or being an ogre. You've got to keep on this, and they'll begin to pick up on it.
Exactly.
Well, as always, thank you so much, Kristin. You are just a wealth of not only information, but of inspiration. You're an incredible woman, and you've done so much for this world. Thank you so much.
Thank you, Ned, as have you.
Okay, please remember to reach out to us with your questions and show ideas. We love them and make use of them. Our email address is connect@distractionpodcast.com. That's connect@distractionpodcast.com. And please leave us a rating and a review on Apple Podcasts if you like what you're hearing. We need those. We absolutely thrive because of those. Distraction is produced by Collisions, the podcast division of CRN International. Collisions, podcasts for curious people. Our audio engineer, Roman Zeitlin. And our producer is Sarah Gurton.